Hello, everybody, and welcome back to another episode of Nursing Surgery, Day 3, Topic 6. Today, I, your nurse, Haiqal from Group 26, will be demonstrating to you the daily hair care routine that will be given from your healthcare worker, such as a nurse, towards their patients. Now, before I demonstrate to you on how we do the daily care routine onto the patient, I will take this time to explain to you why we do it in the first place. Well, first and foremost, it is to observe the scalp of the patient if there is any signs and symptoms of pressure damage. Next would be dandruff. Any buildup of dandruff would be bad because not only will the patient be uneasy, it can also give other underlying conditions. Next would be the most obvious one that a lot of people would expect is the presence of head lice is what we're also checking for. Before we begin, I will list the things that you will need. Sanitary gloves are the first things on the list. Next would be a comb to brush the patient's hair. Then you will need a towel. The towel will be placed on the patient's back and behind the neck to make sure no hair falls on them. And we will need a hair tie. Last but not least, we need the patient. Now we begin the demonstration by unfolding the towel first and placing it gently behind the back and behind the neck of the patient. In this case, the patient has long hair, so we lift up her hair gently and carefully and place it behind the towel neatly so that the patient does not feel pain as well, and we will have an easier time when we have to brush. Now, we brush the patient's hair looking at its strength, looking at the scalp, if there is any sign of pressure damage, any buildup of dandruff, and most importantly, we are also looking for lice while we brush her hair. But we must also look at the type of the hair of our patient. For example, this patient has curly hair beneath her long hair, so brushing it carefully would be ideal. If not, it could cause tangles and also hurt the patient, which is what we never ever want. Now that when we're done with brushing, we need to tie the patient's hair. Usually, some would prefer braids, but this patient has requested me that she wanted her hair into a low ponytail. Thus, what she asks, she will receive as long as the patient's request does not harm her or anyone else. And just like that, we are done. And that sums it up about the daily hair care routine from a healthcare practitioner towards their patient. Remember to hit the like button, subscribe, hit the bell so you will be notified whenever we upload. And don't forget, see you in the next episode.